Hello, Dr. G here from naturalfoodsdiet.org. Today I want to talk about a condition that affects 8.3 million Americans, and many more have the potential to develop this disease. The disease is gout, which is thought to be caused by an elevation of uric acid in the blood, which results in the development of crystals in the tissues, and that causes an inflammatory response in a joint or a bursa, and most commonly, ironically enough, the big toe. I know by personal experience when your big toe swells up like a balloon and you can't even walk, your day is basically ruined. Elevated uric acid not only causes joint pain, but it's also been associated with other diseases like high blood pressure, metabolic syndrome leading to diabetes, coronary artery disease, stroke, preeclampsia, that's elevated blood pressure in pregnancy, as well as kidney disease, including kidney stones. Gout can also attack other joints. Next in line, after the big toe, is the ankle or foot. Next is the knee, then the fingers, and finally the elbow or the wrist. With chronic gout, the joint can actually be permanently damaged and even destroyed in severe cases. Elevated uric acid levels are considered when it goes above 8.6 in men or 7.1 in women, although different labs can use different units and have different normal ranges. High uric acid is more common in men. If your uric acid level is greater than 9, then your risk of having a gout attack is 6 times higher than someone with a normal level. Uric acid is formed from the breakdown of purines, which are part of the structure of our own cells, including the DNA and other genetic material. And it's also a component of the cells in the food that we eat. Foods that are high in purines include the red meat and seafood, as well as some alcoholic beverages, especially beer. That was my own personal downfall. It's been shown that a spike in fructose raises your uric acid, and at the same time, it decreases uric acid metabolism. A spike in insulin also increases uric acid. Remember, table sugar is 1/2 fructose, and it also stimulates insulin release. So eating a lot of sugar is another common trigger for gout attacks. The treatment for a gout attack includes anti-inflammatory medications, such as the commonly used non-steroidal anti-inflammatory drugs, the NSAIDs, and also the steroidal anti-inflammatory drugs can be very effective, and that is a shot of cortisone in the joint or in the bursa. The old standby is taking the anti-inflammatory drug indomethacin. That's what they used when I was a medical student and resident. Taking tart cherry extract or other plant extracts might also treat an acute attack. Colchicine is a drug that disables the immune system and can also be used very effectively to treat an acute attack, but the side effects are often nasty for this drug. Now, if you don't have gout, but you have a high uric acid level, there are drugs that are commonly used to inhibit the enzyme that produces uric acid. That enzyme is xanthine oxidase. These drugs are used to lower the uric acid to prevent an acute attack. The drugs aren't helpful after your attack has begun. The old standby here is allopurinol, which is effective at lowering uric acid levels in the blood. If uric acid levels are kept below 6, then you're much less likely to have an acute attack. If you take these drugs during an attack, like I said, they can make your symptoms worse, or if you weren't having an attack, paradoxically, they can induce an attack. Uric is a new drug that inhibits xanthine oxidase, and it's effective at lowering uric acid levels. But there's a long list of side effects from this drug, including diarrhea, nausea, headache, rash, joint pain, liver problems, and as I said before, this can induce a gout flare-up. There's another plant extract that can be used to lower uric acid levels to prevent gout. This comes from the deciduous tree native to Southeast Asia called the Bahara Tree. It's also called the avenue tree. I imagine that's because this tree gets up to 30 meters high, so it lines the avenue. I don't know. It also has an edible fruit. The scientific name is Terminalia biliaca, and it's used in Ayurvedic medicine for skin conditions, graying of the hair, to slow aging, to boost immunity, decrease cholesterol, decrease blood pressure. Sounds like a wonder drug. A clinical trial was done testing the ability of this tannin-rich extract from the Bahara tree to lower uric acid, and it was compared directly in the study to uric. The results of the study showed that the Bahara tree extract lowered the uric acid levels by an impressive 28% without any significant side effects. Yes, uric lowered the uric acid more, but as I said before, has an impressive list of side effects, including diarrhea, nausea, headache, rash, joint pain, gout flares, and it can cause severe liver reactions. Allopurinol also has potential side effects, so I would always start with the safer plant extract, which is also generally far less expensive, especially for drugs under patent like uric. The difference is paying $5 per day for the drug compared to much less than $1 a day for the supplement. If you'd like to see which specific product that I recommend so that you could talk to your doctor about this alternative to lower your uric acid, check out the link in the description of this video. This is Dr. G. Thanks so much for watching.